Activity type for me, initial visit, so that's the first time we meet someone. I deliberately call it visit, not assessment. I come from an employment background, I hate this assessment thing, because so often we assess people to say you can't have a service because you don't fit. So I call it initial visit, and it's about finding out needs and talking about how we support someone, not do you fit this service. Because if they want to work the fit service, we've got to find out how to support them. Employment profiling, that's any activity that we do to find out about the person and to build a relationship with the person and to help them towards work. And that is mainly community-based. Well, it's all community-based, actually. Employer contact, that's face-to-face contacts with employers directly. And job research is the finding out what the labour market is out there and what jobs are going on and which employers to contact. And we deliberately separate those out because as an employment advisor, it's so easy to do the job research because that's the easiest bit, and I can sit on my laptop and I can have a look, and I can do, in the past it's called a community mapping exercise, and I can go out and find it. But actually, forcing yourself to pick up that phone and to go into that workplace can sometimes be the mentally tougher thing to do. So I want to look and make sure people are doing both. Job analysis, going into the workplace prior to someone starting work and checking out it's the right workplace for them. Checking out if there's any training needs or issues in the workplace that we can help and support with. Employment support, anything to do with with supporting a person in the workplace or outside when they're in work. And benefits admin, we measure this separately just because we've been having so many problems with the changes in the benefit systems and DWP. It's been quite interesting for us to look at, are we having to spend more time doing this? And the answer is yes, we are. It is impacting. So that's anything to do with, for us, people's return to work benefits, permitted work, back to work bonuses, all those things about better off calculations, all those things about returning to work. So it's not about getting people PIP. It's not about that. And just a quick example of what it does for me. So I can suddenly have a look for the whole team profile and look how we're spending that time and what that means. Job analysis is tiny, and it always has been traditionally since we've been in an IPS service. We find people need employment support, but not a lot of people need lengthy job analysis where you spend time in the workplace before we place them there. One of the things I need to work on, I'm not happy with the split as a team between job research and employer contacts. So one of the things we've got to work on in the next 6 months is the employer contact segment needs to be bigger. I want a bigger green segment at the end of the year. But at a glance, it just gives me useful information, and I can do that for each individual employment advisor. I can also do it for job seekers as well. So if I want to know exactly how many hours and what type of activity with a job seeker, I can do that as well, which has been useful in the past for commissioning purposes. We also have an employer database. It's where we keep a list of all the employers we've ever contacted. There's a lot of them in there. It looks a little bit like this. It's really simple. It's on a shared drive. All the employment advisors have access to it, and they input their own contacts in. So every single contact they make, they're expected to input into this. So that if I then am thinking of contacting a local employer, I can go and have a look and see if we've contacted them before, when, where, what contact was. So we have a front page, which is all contact details, and a back page, which is all what we did and when, and the type of activity. And shared drives are really important to us. We're in separate locations. So we have an S drive, and it's like our Bible. All our forms and templates are on there, our employer database, our timesheets, so we can all access that information. Outcomes. Okay. I've actually focused on referrals first, and there's a reason this is important to me, because 2011 was the transition from being a segregated specialist unit into community mental health teams. And referrals come from practitioners still. They come to individual employment advisors and are fed to me and monitored through me, but employment advisors pick them up, be that within NDTs, be that within outpatients, just with discussions over a cup of tea. There's lots of different ways that people refer to us. It can be an email. We do have a form. It's one side. It's not complex. They leapt from 2011 to 2012, and I thought, oh well, you know, that's to be expected with somebody there. They can't avoid us. My face is there every day. They'll be made to think of me. But actually, when I've looked at 2013 to date, it's the same this year, and I'm particularly pleased about that. They've actually increased again. Or the trend continues, they will have increased by the end of the year. And I'm actually quite pleased about that. We've been talking on our tables about, you know, employment being everybody's business in the CMHT and how we do that. And perhaps I was just a bit concerned that there'd be this initial flurry and then it'd stop. People get used to us being there, employment drop off the agenda. Oh, that's Caroline's job. We'll let them talk to her about it. And that doesn't seem to have happened. And I'm really, really pleased with that. And that's where I get really proud of the employment advisors that I support, because they've worked really hard to do that and to keep their profile in the team and to build relationships with their colleagues. What we've found is we're having to work so much harder with employer contacts. We're having to contact so many more employers and do it so more regularly, more consistently. Keep going back. It's not that the jobs aren't there, we're just having to work a bit harder to find them. Seems to be one of the impacts in our area of the recession. And again, that's increasing this year. Again, I'm pleased to see that increase, because it was one of the things I worried we'd lose with co-location. The employment advisors would go, Caroline's not watching us, we're not supporting each other with this. We'll leave the difficult bit to one side to later. And they haven't, and they're out there and doing it. We're a tiny team, there's 4.5 of us, not very many of us. 2011 was the year we changed. We had 7 staff and we got 25 jobs. In 2012 we had 4.5 staff and got 22. I'm on track this year. We're not talking massive numbers. We're not a massive team. But I guess from my point of view, I was really pleased that we've been able to maintain that rate with less staff. And it is difficult out there at the minute. And then the other bits. We had a fidelity review. Jeff Shepherd came in 2012 to one of our teams and scored us exemplary. So we were like, and especially identified some of the individual practice of the employment advisor and the service itself, and some of the sort of information tools we have and the focus on employment. And then he came to where I work, Moss House. And I got a good. But one of the reasons for that is there isn't anybody in the trust to supervise me, clinically, if you like. I'm an employment specialist. I'm sort of struggling to find someone to give me specialist supervision. I can do it for the employment advisors, there isn't someone to do. And this is one of the things we haven't got right yet in Mersey Care, strategic support. That's strategic leadership and building IPS clearly into an employment pathway for the whole trust. And this is one of the development areas for us. So when I said at the beginning, I just know a bit about it, I'm not an expert. There are development areas for us, we haven't got all the answers. Key learning in all that. Clear focus on employment and values. I come from a supported employment background. I come from this thing where the only criteria to work is if you want to. There are no exclusion criteria. If you want to work, I have to find a way to get you there. And that's it. And actually maintaining that strong value base within services that aren't always recovery focused, within services where you sit at a team meeting and talking about SIPs, and if we don't stop ordering station, we want to be a job so go, which happens, sitting in services where you hear some negative things. It was a culture shock. When I went into community mental health team, we had a massive culture shock. So that's why keeping together and keeping our values has been so important to us. But yeah, values. Anybody can work who wants to with the right support. We just have to want to. Building relationships with our colleagues in CMHTs, really important. Joint visits, ad hoc advice, attending team meetings, attending monthly disciplinary team meetings, sitting in outpatients, clinics, anything and everything we have to do to make sure we have strong working relationships with our peers in the community mental health teams. Employment advisors, it's the IPS model. We do all aspects of employment support. We don't do just one bit of it. From someone comes into service, we see you, we start talking about employment, we only stop working with you when you're in a job that you want to do, that you're doing independently and happily, and you tell us you don't need any more support. And then that's what the proviso, and you come back. If anything happens, anything changes, you want a new job, you want to progress in your career, you come back to us. And we do everything in between those 2 points. Retention service, I thought, and this might not fit ideally with IPS, but I thought to keep this. And there's a couple of good reasons I did. What I mean by retention is where someone is in work and may currently be off sick or they're in but struggling, we will take a referral to support them to maintain their job. Doesn't necessarily fit with IPS, but it builds us excellent relationships with employers, and it saves me getting someone 2 years down the line who's fallen out of work and been out of work and got embroiled in the benefits system. If I can help them retain that job, I'm not having to bring them in at the beginning of the service 2-3 years down the line and start that work again. There's a bit of debate in our team about that one, and I'll leave it open to yourselves about what you think about it. You can get bogged down in it can be very time consuming, and we've had a debate about, does it fit IPS, should we be doing it? And where we've come to now is, yes, it's manageable. We share that out across us in the team, and it supports a lot of the other work we do with IPS, but it is something we constantly review, and I know people will have different feelings about that. The role of operational lead, me again, but ironing out problems quickly, especially when we first moved. Things you don't even think of, like the employment advisor was put on the duty rota. Phone call, the same HT manager, why have you put the employment advisor on the duty rota? It's a specialist role, they shouldn't be taking crisis calls all day. And the argument was only wrong because they said you're wasting your resource. Do you want to waste your money? And you went, oh, I never thought of it like that. But anything like that, it's just getting in quickly. So any sort of teething problems like that, just having someone with clear focus, a willingness to stand up for what you're doing, and a willingness to actually ruffle feathers and just say, no, that's not acceptable. It doesn't fit the model, it's not an employment service, they're not doing it.